send out an invitation. Where?
Press E and message button. No. She said invitation.
Yeah, I know what you're talking about because I've done it before. I know what you're talking about because I've done it before.
I don't even see you.
Really? I'm on my Healthy Me. Hey, Deanna. Okay. She can hear me now. Just waiting for some people to join. I'm still traveling. We're almost back. Is it allowing you to share it?
I'm sure.
Okay. Just waiting for a couple more people to join us. At any time, if anyone has any questions or concerns, please type them and I will address them. Hi, Howie. If you guys see me moving around, please excuse me. I'm en route, but I didn't want to delay going live. I wanted to get the information out to people. How's everyone doing? So the reason why I decided to go live this evening to address issues and concerns about COVID-19, because I've been very disturbed looking, first listening to social media, listening to the news, looking at social media. There's a lot of information that's circulating and it's giving our people false information. And I think that knowledge is power, and we need to make sure that we get the right information. So
red light camera reported ahead.
To protect ourselves as a whole. I'll start off by addressing the COVID-19 virus, also known as the novel coronavirus. So for those who don't know, coronaviruses are not new. Corona is a type of virus that has been around for a long time. It's similar to the common cold. A lot of people who have been sick, you probably have had coronavirus in the past. You just didn't know it. This new strand, however, which is called COVID-19, is a new type of coronavirus. So it's not like it's been out or the government predicted it beforehand or some big conspiracy. This COVID-19 is a new type of coronavirus. That's where the name novel comes from, meaning it's a new form or a new type of virus. So what is COVID-19? It is a really bad cold, similar to the flu. The difference between the flu and this COVID-19 virus is we about influenza. We know how the flu comes about. We know how to treat it. We know what to do once you get it. But anything new requires for us to study it, to see how it behaves, and see what kind of things we can put in place to help people. So because this is fairly new, happening around October and November, started in China, as you can guess, we don't have a lot of information about this new virus. What we're finding out, and when I say we, I mean the CDC and the World Health Organization, is as we're studying, we're finding out how this virus behaves and how it acts. So what they have come up with so far is that it's spread from person to person through droplet. What does that mean? That means if you are within 6 feet of a person who has COVID-19 and they talk and droplets come out of their mouth, which it does come out when we talk, and it lands on a surface that you then touch with your hands, and it gets into one of your orifices, meaning your eyes, your nose, your mouth, you can then contract the virus. Another way, when you say droplet, is if someone is talking and droplets come out of their mouth and you then inhale because you're close enough for the droplets to come in your area, then you can then get the virus. People, please, it is important that we know the correct information. I've seen posts, I've seen articles telling people there's ways that you can know if you have this virus. The only way to know if you are COVID-19 positive is to actually be tested for COVID-19. And that's through, right now, New York State, the CDC, and I believe as of tonight, they're going to be putting satellite offices in places where you can go and then get tested. You cannot determine whether you have COVID-19 by holding your breath for 10 seconds. Do not do that, please. You cannot prevent it by drinking ice cold water every 15 minutes. Impossible. The best way to prevent from contracting COVID-19 is by simply washing your hands. When I say washing your hands, when I speak of droplets, when those droplets land on surfaces and then you touch those surfaces, and we as a people a lot touch our face, and we do it not even thinking about what you're doing. We touch our face, we rub our eyes, we rub our nose, we pick things in our mouths. We do these things without realizing we're doing because it's an automatic response. So hand washing is the best way to prevent COVID-19. Also, when they say stand within out of the area of 6 feet within another individual, because when I speak about the droplet precautions, if you're out of 6 feet away from the next person, those droplets are not getting to you. So you're out of the airspace of the next individual. It's very important that if you feel sick, meaning you have signs or symptoms of a cold, because at this point you wouldn't know if it's COVID-19 or not, but if you feel ill, you feel like you have chills, you're running a temperature, or you have a cough, a runny nose, a sore throat, take precaution. People, please take precaution. Call your primary care physician. Do not, I repeat, do not go to the hospital unless it's something that you cannot manage at home, meaning you are short of breath and you can't breathe. Your temperature is not breaking with you taking Tylenol or Motrin. It's important that we don't flood hospitals at this point unless you're seriously ill and need hospital attention. At any time during this message, if you have any questions or comments, please leave them in the message. One of the other things I wanted to address is I had people asking me, well, what if I have the flu? How do I know the difference between the flu or COVID-19? And I think that's an excellent question. Whether you have the flu or COVID-19, it's important that you stay home. Again, whether it's the flu or COVID-19, it's important that you stay home for two reasons. The first reason is you need to take care of you. And anyone who's had the flu before, you know that the flu makes you feel really, really bad to the point where your body requires you to rest. Number one reason why you should be home, rest your body. The second reason why you need to stay home is because you need to keep the flu to yourself. While we are a loving people and we like to spread love, we don't need you to spread your germs. And I mean that in the best way possible. So whether it's the flu, you feel a little ill, remember, you're still coughing, you're still sneezing, there's things coming from your body leaking. We don't need that. No one else wants to be subjected to that. I know there's times when we feel like, listen, I'm just a little sick. I can go. Now is not the time. When we are in the time of a pandemic, meaning that this thing is spreading, we need to be able to control this. This is not the common cold. People are dying from this thing. And the people who are dying are not people that look like you and me. They're the older population. That's the population that we need to take control and make sure we take care of them. How do we take care of them? By making sure if we're ill, we don't subject them to what we're feeling and we don't give them what we have. The second population that's being affected by this COVID-19 is anyone who is immunocompromised. What does that mean? That means that I have a chronic or an acute condition that is causing my immune system to not be able to operate at its highest level. In that case, when a new infection comes into the body, your body is not able to fight off an infection like someone whose immune system is intact. And that can be for various different reasons. So it's important that we take care of us as a people. And like I said, knowledge is power. Hand washing. Let's go back to hand washing. Now, I know hand washing has been something taught, and we always said we should be washing our hands anyway. And I want to believe that the majority of us do wash our hands. However, we don't wash our hands properly. When I say properly, I mean you're supposed to wash your hands for at least 20 seconds. And making sure that when you wash your hands, that you're getting underneath your nails, you're getting the back of your hand. It's about taking your time. A lot of us wash our hands because we're in a rush. It's something we need to do, and we're doing it so we can move on to the next task. But take the time and wash your hands. Teach your children. Sing the ABC song or the happy birthday song. It's a good way to kind of get that 20 seconds in to wash your hands properly. Parents, go to the bathroom with your children to make sure that they're washing their hands properly. Now, because I said that this is a new virus and we're still learning things every day about this virus, it's possible that you can be a carrier of this virus and not exhibit any symptoms. With that being said, it's even more important for us to wash our hands and to teach our children how to properly wash their hands to prevent the spread of this thing. Another point I wanted to make is I know today it's been announced that in New York City, the public schools are being closed. A lot of people have ambivalent feelings about that. But just stop and pause for a minute. We're trying to control and prevent the spread of this thing from getting worse by any means necessary. I would rather, and I don't want to use the word suffer, but I would rather have my kids at home with me, probably getting on my nerves, than have them get sick or have them to have other people get sick. An ounce of prevention, people. It's okay. We will get over this. And with me saying all of this, we are not a doomed people. We are not all gonna die. This is not some big elaborate plan. The government is not putting this out to kill us off. We will get through this like we get through everything else. We've gone through 9/11. We've gone through an earthquake. We've gone through black people. We will get through this. Let's just think about our ancestors. They survived slavery. Some say we still have it today. But we are resilient people. We will get through this. Yes, this is trying times. But I am a believing person. And I believe that God is in control. And no matter what, He is going to get us through this. I heard someone yesterday and today talking about the believers and Christians and why is churches still open. So let me address that for a little bit. In times like these, we've been through this before. I mentioned slavery. We have always gone to the one who gives us our power, the one who's in control of everything, and that is God. If you believe in God, you know that He has the power to heal like no one else. I don't care what the doctors are saying. I don't care what the government is saying. I don't care what you might be feeling right now. The enemy wants to make you believe that we are a defeated people. But guess what? We are not defeated. We just have to move a little differently than how we've been moving thus far. I don't think there's anything wrong if you want to go to church and your church is open. By all means, you go. Just take precaution, meaning wash your hands. If someone looks as if they're not 100%, they might be sniffling and coughing. Take precaution. I'm not saying that we should be isolating people and spraying Lysol on people. By all means, we're not that kind of people. We shouldn't be doing that. But you might want to stand back from your brother or sister. You might want to say hi from afar. These are times that we have to be educated. So we have an advantage, meaning the United States, because this thing started in China, and we had a bit of a time to watch how it reacted in China and how Italy and thus far, but now it is here. It is amongst us. We've lost five of our beloved people in New York City, and we don't want it to be 5 more. However, with that being said, this will spread. Again, this will spread, but it's not the end of the world. Like I said before, how many people on this call or this live video right now have had the flu and you've gotten over it, right? It's the same thing. We will be okay. We just have to be a cautious people. So let me go over symptoms of COVID-19, which are very similar, however, to the flu. So, fever. Having a low-grade fever, anything 100.6 and above, a low-grade fever, you feel a little achy, you have a dry cough, you start feeling as if you can't breathe, shortness of breath, having difficulty taking breaths, a runny nose. These are things to look out for, especially now. Not if you've had it before, if you have sinuses and your nose are always running. I'm not talking about that. I'm talking about new onset, meaning you wake up tomorrow morning and you start to feel a little different. That's something you need to be a little concerned about and follow up with your primary care physician. If you feel ill or you're concerned, do not go out in public. I repeat, if you feel sick or a little ill, do not go out in public. Call your primary care physician. Again, call your primary care physician and have him or her direct you on what you should do next. What we are telling our patients who are calling in and complaining and wanting to be tested is, if you feel ill, just stay home, monitor your temperature, monitor your symptoms, and if you feel like it's getting to a point where it cannot be controlled at home, then we will direct you what to do next at that time. Any questions, any concerns, please feel free to put it in the message box. I want to make sure everyone has an opportunity to get a clear understanding about COVID-19. I'm tired of the foolishness. I'm tired of seeing nonsense. I want my people to know knowledge is power, and we need to take our power back. Any questions? Any concerns? Yes, I'm still in the car. I do apologize. I was en route on my way home, so I apologize for it being a little dark. The other thing about COVID-19, and I want everyone to kind of be concerned, well, not concerned, just be alerted, is you can be subjected to it and not have all the symptoms and still be a carrier. Okay, I have a question here. It says, do you recommend that kids stay in the house during the break from school, or is it okay to visit parks? So that's a great question, and thank you for that question. I recommend that although the kids are going to be in the house and it's to prevent, you can take them to public areas, subject them. Having kids home in the house for a period of, 30 days is not going to help. The kids will drive you crazy. Kids need to be able to stretch, to park, to run, to play. So yes, I recommend taking them out of the house, taking them to a public place, but make sure that you have the proper things. Tools meaning hand sanitizer. As soon as they come back in the house, make sure they are washing their hands. It's important that if you have little kids or little babies, toddlers, that we know like to touch everything and put their hands in their mouth, that you monitor them all the time to prevent them from putting things in their hands in their mouth. We need to make sure you have clean hands. Again, it's very important to make sure your hands are clean. I'm sure during this 10-minute live video, I probably touched my face. We do it without thinking about it. It's important that you keep our hands clean. But yes, take them out, take them to a park, take them to, somewhere where they can breathe a little bit. Even if it's just walking up and down the block, it's okay. Let them have some fresh air. Let them move and breathe and run and stretch their legs. And it might even tire them out so they're not as aggravating and annoying in the house with you. Give you a little break also. But yes, take them out, let them breathe. And the same goes for adults. If you're not sick and you're not exhibiting any symptoms, it's okay for you to go for a walk. It's okay for you to go to the park. It's okay for you to go out the house. Just take precaution. Take precaution. I know that there's a shortage of cleaning supplies. I know it's hard to find hand sanitizer, but just use soap and water. I can't tell you how important it is to simply wash your hands. It is so important. It goes a long way. Wash your hands. Make sure your children, make sure your grandma, the grandpas, make sure they're washing their hands. A lot of times they don't know how to properly clean their hands either. So it's up to us. And I'm educating everyone here so that you can go and share this information with someone else, because knowledge is power. And that's the only way we're going to get through this, is by learning and adapting. But thank you for that question. I think that was a great question. Are there any other questions? Any other concerns about COVID-19? Things you've been hearing, you want to know if that's true. This is the time to answer. This is the time to ask your questions. To ask your questions to get a better understanding. If it's something that you've heard you're confused about, or something that was said and you don't know what that means, this is the time to ask. This is my reason for going live, and to kind of give you as much information as I can. Thank you, Lillian. I appreciate that. I think I keep saying it, it's important because when we have false information, when you're going around and you're thinking that by drinking cold water every 15 seconds, you can tell if you have things, and this is what's going to come to our demise. This is how we as a people will come to our demise, because we don't know. And when we don't know, we go by what we hear. And social media, while it's great for some things, is not all of that great for getting good information and correct information. I recommend 2 organizations to get your information from. The CDC, which is the Center for Disease Control, has great information on their websites. They have now toll-free numbers you can call. You can text and get information. And the second one is the WHO, which is the World Health Organization. They also put out some great information. People, please fact check everything that you're hearing, because not everything that you're hearing is true. Amen. Not everything you're hearing is true. What should we do if we have elderly or medically fragile family members or friends that we usually care for or check up on? Continue to check up on them. Unless you are feeling ill or have been around anybody ill, continue to check up on them. They still need your love and support. They still need your help like they will anybody else. Just take even more precaution with them. Because remember, I said this is a new virus. So we don't know if you are asymptomatic, meaning you have no symptoms, before you start to show symptoms and you're positive. So just be extra cautious. Set up before you go and you see them, you want to make sure that, your face and your hands is clean. You haven't been around anyone sick. But the first time you come in the house, go wash your hands. And you might want to not talk so close to them. You might want to kind of distance yourself just in case. What about masks? Should expel be walking around? Okay, great question. And this is good because I saw people today in the supermarket walking around with masks. People, save the masks for people who need them. The problem with pandemics, the problem with epidemics, the problem with things like this is that we all get anxious, we all get scared, and then when we are scared and we're anxious, we do things that are not necessarily the correct things to do. Unless you are ill and must leave the house, you do not need to wear a mask. And the reason why I say this, and I'm so firm on this mask wearing things, because anybody who's in the medical profession, we have been taught how to properly put on a mask and how to properly take off a mask. And what I see is people wearing masks, it's covered on it. I'm not touching my face, by the way. It's covered on their face, and I see people taking it off and going like this and taking it off. Anybody who knows anything, if you're protecting, if you have on a mask because you're trying to protect yourself from the outside, anything coming on that mask is on the surface of the mask. You touch the mask to take it off. Guess what? You've just contaminated your fingers. And then what's going to happen with your fingers? Your face, right? Unless you need to wear a mask or you're directed to wear a mask by a medical professional, you do not need to wear a mask. We don't act this way with the flu. Someone has it, they take meds, and the rest, and they're eventually fine. Why is this so different? I agree. So part of the reason is because, remember, I don't know if you were on in the beginning, this is a new virus. So the flu has been around a long time. Coronavirus has been around for a long time. We know a lot about these different viruses and these different illnesses. Because they've been around, we know what to do. We know once you get it, we give you some Tamiflu. 5 days later, you're on your way to recovery. This is a new virus. This is something that we're learning as it goes along. When it first hit China, we didn't know what it was. And they still are studying, trying to get a better understanding about the virus. So anything new, anything that's out of the ordinary, anything that just pops up, people get frantic. They get afraid. We are human. Then you listen to the media. You go on to social media. You listen to the radio, you hear all of these press conferences, and it just adds to the frenzy. And I agree with you, Nadine. The flu has been around so much. You get it, you take some medicine, you rest, and you get over it, right? It's the same thing. If you are a healthy individual and you come down with coronavirus, guess what? You're going to get over it. But because it's new and because it's so out there and everyone is afraid and we're learning and we're hearing so many crazy things, we are all up in an uproar. Should we be wearing masks in the street? I think I'll address that. Unless you are ill and you have to leave the house, you do not need to wear a mask in the street. That adds to the hysteria. Think about you being somewhere and you see someone with a mask. What do? You automatically think about, oh my gosh, corona. Then you're wondering, does he have it? Does she have it? What's going on? It adds to the frenzy. Unless you are ill and you have to leave the house, you do not need to wear a mask. The second reason for not wearing a mask is for when we really need these supplies, they won't be around. And this is evidenced by you going to the supermarkets and trying to get your food or your toilet tissue. There's none on the shelves right now. The same reason why. Because when you really need it, people who need it won't be able to get it because those have just went and bought up everything. Same thing with the mask. You don't need it. Good questions, guys. Any more questions, please? This is what I'm here for. I'm here to help educate our people because knowledge is power, and when you know better, you do better. This too shall pass. And it's funny because I'm in the car still because I haven't got in the house yet. I went to church today. I am a registered nurse. I work in New York Presbyterian Hospital, which happens to be the first hospital where the first patient with COVID-19 was diagnosed and is being treated. And we've had many COVID-19 patients come through there. Not everybody needs to be hospitalized, as I said before, unless you are really ill, meaning that you're having a hard time breathing, you're compromised, and it's really taking a toll over your respiratory system. You don't need to be in the hospital. So we've had a lot of patients that have been COVID-19 positive, and they go home. We send them home. They are quarantined. There's a protocol put in place for anybody who is COVID-19 positive, and they must follow that protocol, which includes being quarantined for at least 14 days, and then they still have to get tested also because some people have even gone beyond their 14 days and still been positive. So it's just, so I say all that to say, I am a medical professional. And I think I've been exposed maybe to this thing more than anybody probably on this live right now. And I can tell you with the reassurance that it's okay. It's okay. It's not anything. It's not the end of the world. It's not anything for you to be anxious over. It's not anything for you to even lose sleep over. This too shall pass. It's something that we're dealing with, and we're going to deal with it. So the schools are closed, and I think this was a great move. I'm not sure why it took so long, but what we need to do now is to contain it and prevent it from spreading further. And anyone who's been following the news, you know that it's projected to double. The amount of people who are COVID-19 positive, they're expecting it to double. And what they're doing by closing the schools, I'm hearing some restaurants now, and limiting the amount of public exposure, is because we're trying to contain it. And because we know it's spread from person to person, and in New York particularly, we live in very close quarters. Everyone is on top of each other. So even when you ride mass transit, you're sitting very close to the next person next to you. So what they're trying to do is to prevent it from spreading quicker than they can control, because we only have a certain amount of beds in the hospitals that can kind of treat this thing. We're trying to get it and control it before it gets out of control. Should asthmatics, etc., be more cautious since the attacks? Yes. I said earlier, anybody who is immunocompromised or who has a respiratory condition, actually anyone who has any kind of chronic medical condition, especially respiratory conditions, asthmatics, people with COPD, emphysema, because your respiratory system is already compromised, this type of virus can put it in overload, meaning that it has to work even harder than the person who doesn't have any kind of respiratory condition to fight it. So yes, I would be more cautious. My middle child, my 15-year-old, is asthmatic, and I taught her and took the time to make sure she's aware and she knows what to do. And if she's around someone who's sick or ill, she knows to move away. This is part of the reason why I think it was a good move to close the schools, because even though she's being cautious, but she's in a class with somebody else who's coughing and sneezing, she doesn't know, right? You don't know. You just don't know if the person has been around and is exposed and what they have. So this is a way to kind of prevent it. So I know my immediate family, none of us are ill. So I'm okay with being around my immediate family. She's okay with being around us. But when you go into the public, into any place that's crowded or you're in close quarters, then that's when you pose the risk, because you don't know where the next person has been or what they have. I hope that answers your question. So yes, you should be extra cautious. Absolutely. Any other questions? This is good. Any other questions at all? I'm surprised nobody asks about pregnant women. Like anything else, a pregnant woman, you just need to be careful, because when you are carrying another child, of course, there's certain medications and things you can't take. So you want to make sure that you're being even more cautious, just like the asthmatics, just like the people who are immunocompromised. You just want to be cautious at this point in time. You really want to, this is a time now where, as a whole, as a people, as a city, we need to just take this opportunity, spend time with your loved ones, do the things that you've been putting off that you need to do for a long time. Some people need to write papers, they're still in school. Some people have been saying they want to do things. Take this opportunity and just do that. Really just limit your exposure if you can. Like I said, it's okay going for a walk, it's okay going to the park, but anywhere where there's going to be a lot of people in a close quarters, I would say, especially if you are immunocompromised or sick, do not go. Stay home. Thank you. I don't know how to say your name, Mr. Morris. I appreciate that. Any other questions? And like I said in the beginning, for those who are just joining after I started this live, my reason for doing this is because I want to make sure that people have the correct information. I believe knowledge is power. What God gave me, this is not just a job for me. He has given me this ministry, and I call it a ministry because it is important that we help each other. My knowledge is not for me alone. My knowledge is to help the next person. And I'm hoping that those who are watching this, that you take what you're learning from here and then you spread it to the next person. We're spreading all this other nonsense. Let's spread the truth. Let's know what really is the deal, and let's get over this thing, because it will pass. It will pass. And it's not going to pass tomorrow. It is not going to even pass next month. But it will pass, and we will get over this. Any other questions? Any other questions, concerns? This is the time now to ask. Anything you heard, you want to make sure it's true. Anything at all. Anything. Now is the time to ask. And for those who are just joining, any questions you have, you can still ask. No question is stupid. This is for us to learn, and so we can do better as a people, so that this thing can pass and we can get over it. Is this born by air or air? So it's droplet precaution. So for those that are not in the medical profession, droplet means like when we talk as individuals, sometimes droplets come out of our mouth. Those droplets then land on surfaces around us, or if you're close enough, they can land on another individual, and then they take it in through their nose, their mouth, and their eyes. So it just means droplet. Airborne means if I simply just speak and it's in the air, it's just traveling through the air. This does not travel via the air. It is not airborne. It does not travel via the air. It travels because it is droplet. Means my droplets out of my mouth go and they land on surfaces. Those surfaces then become contaminated. I, not knowing that the surface is contaminated, go and touch it. And then what do? We touch our mouth, we touch our nose, we touch our eyes. And it gets in, then it gets into us. That's what droplet means. Or I'm close enough to the next person to where they're talking and their droplets are coming out and it's getting directly on me. That's droplet. So it's not airborne. If this was airborne, we'd be having a different conversation. It's not airborne. And even in the hospitals, when we're treating patients that are COVID-19 positive, we are wearing, it's called PPE, protective equipment, personal equipment. It's to protect us, to keep us safe. We are trained on how to wear these equipment. The average person does not know how to don a mask, put a mask on, and how to take it off. Which is why when the question was asked about the mask wearing, should we be wearing masks? No, unless you are instructed to wear a mask by a medical professional, you should not be wearing a mask. Or unless you are ill and you have to leave the house for a particular reason, then you should do so. You and I don't need to wear masks. I go into the hospital every day. I am not wearing a mask. Unless the person is on a certain precaution, then I will put a mask on. But the average person does not need to wear a mask. No. And no, it's not airborne. I hope that answers your question. You're welcome. You're welcome. Any other questions concerning COVID-19? And as I said earlier, coronavirus is not a new virus. Coronavirus has been out for a very long time, similar to pneumonia, similar to the flu. However, this particular strand called COVID-19 is a new strand of coronaviruses that has been recently found. What if I want to visit a friend who just had a baby at the hospital, but you feel perfectly fine and you don't have the flu? Do you still stay home just to be safe? Okay, so this is a great question. So I know, just like my hospital, many hospitals in the area are taking precaution. And many of them are limiting the visitors coming in, especially to vulnerable populations. So yes, your friend just had a baby, and I get it, you want to visit the baby. But at this point in time, because you don't know if you've been exposed or been around anybody, it's better to be safe than sorry. And things like this, which I think modern technology is wonderful, FaceTiming, being able to, other ways to kind of see and talk with each other, this is wonderful. This might be the opportunity to take that. Unless it's a mother and your child is having a baby, someone really close that you need to be there. Right now might not be the best time to do that. This is the time really now to be in prevention mode. If you're not sick, you want to stay that way. You want to prevent yourself from getting sick. Just like how you want to, if the flu, you don't want to get the flu, you want to be, prevented it the same way. So right now might not be the best way. And I know a lot of places, I know nursing homes, especially nursing homes, because that population is the most vulnerable. We saw what happened, in Washington. They're limiting all visitors. That's personal, that's private, that's spouses, that's siblings. They're not letting anyone come in right now. And I know it seems harsh, but it's for the best. It's to prevent and protect. And that's why I think closing the school is doing the same thing. It's to prevent and to protect. This is the time now when we need to be proactive and not reactive. What to give the children for that? I'm not sure what the question is, what to give the children for that. I'm not sure exactly what you're referring to when you're asking about what to give the children. And also, this is good too. You just reminded me when you said what to give the children. Parents, any aunties, any uncles, because the media has been covering this COVID-19 nonstop, please take the time and educate our children. When we as an adult are scared and we're anxious and we're trying to figure it out, imagine how our children feel. Stop and take the time and let them know what is going on. Teach them how to properly wash their hands. Teach them what to do in these situations, because they are hearing everything. They see everything. Take this opportunity and teach them. With the schools being closed, let them know the reason for the schools being closed. Let them know how they can be proactive in their situations and how they can help one another. In a city as big as ours, how long could it really take to contain this? That's a great question, Shannon. Now, I know optimistically, they're thinking about 4 weeks, a month, which is like around the April 20th date. Like, they're trying optimistically. This question, or how we respond as a city, is going to depend on every one of us. If we follow directions, if we do what we're supposed to do, we can contain this thing pretty quickly. The problem is, a lot of us are not going to follow directions. A lot of us are not going to do the things we need to do. And a lot of us are going to just do our own thing, unfortunately. And that's where the problem is going to occur. I know of people, myself personally, who are ill and who have been around large crowds. That's what is going to put us all in trouble. So this is why this is important, so we can kind of go to the next person and help the next person and teach everybody, so that we can all be proactive in trying to get this thing contained. So, I mean, best case scenario, they're thinking a month. I mean, look at China. Their numbers have now decreased drastically, and this thing started with them in November. So hopefully we don't have to, go as long as they did. But I think we're heading in the right direction by closing the schools, by limiting large crowds, limiting social interaction. I think this is going to help us, and I think we can get a hold of this thing. I do think. At this moment, if my daughter were having a baby, I still stay away for her child's safety. Right, Kayla? I get that. I don't know if I was in a situation if I would. But yes, I mean, it's just something to make you stop and pause and think about, before you make the next decision, before you leave the house. Some of us have to work. We have no choice. But now I'm more vigilant. If I'm taking public transportation, I'm more vigilant. I am making sure that I have my hand sanitizer, not in my bag, but it's in my hand. Because if I have to go in my bag to get my hand sanitizer, guess what? I'm contaminating my bag. So it's just it's a way for us to be, more vigilant, more cautious, and, just to be more alert as a people. Yes, had to tell my child, just because someone coughs doesn't necessarily mean that they have the virus. They definitely need an adult to help them process the situation. Yes, absolutely. Absolutely. And we can't leave it up to, the media. We can't leave it up to social media. We can't leave it up to your neighbors and those around. We need to be proactive. We need to educate our own. We need to tell them what they need to know and how to, be cautious. But yet, don't shun people. I see the Lysol spraying. I see people moving away. I mean, think about the type of people we are. If that was you, you wouldn't want to be treated like that. So let's treat others the way we want to be treated. It's that simple. Treat others the way we want to be treated. But be cautious. Any other questions? Hi, Diamond. Thanks for joining us. Any other questions? And I know, and I want to address this too, because I have two that are in college who are graduating this year. And they were actually, shockingly, very upset that their campuses got shut down and, is now in virtual mode. But like I said earlier, I would rather you be safe, be healthy, be here than to not be. It's just that simple. That's why we're taking the precautions that we're taking now. This is the reason why schools are closed, and this is why we're limiting social interaction. We just have to be cautious. And we are people, we don't like to be told what to do. We don't like it. I don't like it. But guess what? There's sometimes we have to, and we have to follow directions. That's why we have order. And again, for those just joining, for more information, please, the CDC, the World Health Organization are two great sources of information. Do not listen to everything you see and hear. Please, I beg you, do not listen to everything you see or hear. People will perish just from listening to the wrong information. There is no cure right now. So if someone is saying they have a cure, if someone is telling you there's a way to find out if you have this virus other than being tested for it, do not listen to them. That's false information. And as much as I don't like the president right now, it's fake news. It is. This is why we have to educate each other. This is why I'm having this forum today, so we can get the correct information. Any other questions? We have another 4 minutes left before this live is ended. Any other questions? Please, now is the time to ask. There's no dumb questions. There's no wrong questions. I'd rather you ask and get the right information to assume and not have the right information. Anything? Any questions? Anybody? I think we covered a great deal of information during this forum. I will save this and make it public if anybody wants to refer to it or wants anybody else they want to show this information to. I definitely will do that. I just think this is a time now for us to just pause. As New Yorkers, we are busy. We don't stop. We keep going. But now is the time for us to pause. And what you do in that pause is what's going to make the difference. You're welcome. You're welcome. And I just want to end this. I didn't want to end this without, just for those who believe in the word of prayer, let's just have a moment of prayer as I end this. Lord God, we're coming to you this evening. We're coming to you because we want to say thank you. We want to say thank you for all that you do, for all that you've done, and for all that you will do. We're coming to you now in the time when there's crisis going on. We're coming to you in a time when the world says that, things don't look so good. We're coming to you in a time when people are anxious and they are scared. And we're asking for you, God, for you, the one who have all the power, who have all the control, to comfort your people, God. Guide your people. Let them know that you are still in control. You are there. You have gone nowhere, and you're still in the seat, God. And we thank you for that. We want to ask you that you just go and comfort all of those who desire it and need it, God. Let them know that whether it's COVID-19, whether it's the flu, whether it's pneumonia, whatever it is, that you are the key, God. Let them know that you have everything under your power. God, just let your people know that you are with them. You have never gone, and you are still here with us, God. Calm the world, God. Touch especially New York City, God. Help us through this situation, because we know that this too shall pass. We ask you these blessings in your Son Jesus' name. Amen. I hope that it's been helpful for everybody. Thank you so much for logging in and coming on to live. And if you want me to do more topics again in the future, or you just want to do this again, just hit me up and let me know. I'll be happy to do it. Okay. Thank you so much, guys. Have a good night.